I'm Jeffrey Griffin alongside John Dunn from Health Team Advantage.
Good morning, Jeffrey.
Best time of the year, especially if you're looking to make the right decision for you and your Medicare Advantage plan, right?
That's exactly right. I don't want to make anyone panic, but the clock is ticking.
So, all right, go ahead. Let's hit the deadline. We've got until 11:59.
December the 7th.
Don't panic because you're not in this alone. If you want to come visit us, there's the local benefits office.
That's exactly right. Drop in, see us, no appointment needed. If you prefer to make an appointment, you can by calling us or going on our website, htanc.com, and there's a place there towards the bottom of the page to schedule an appointment if you'd rather set a time.
If you got to bring papers, fine. You got that big brown envelope with all your stuff folded up in it. Bring your medicines.
That's right.
Your old card.
Everything you can think of.
Or the phone number to call, 336-920-3648. And the best thing about that, you're not starting over. You're continuing the relationship. You're calling a friend.
That's how we want you to feel. This is a relationship. We're not in it for short term. We're here to help you all the way through the process.
Some folks will go, well, now we're getting it too late and I'm behind and I hadn't got started. No, time's creeping up on us. It is, but there's still time for you to make an informed decision and take care of everything.
Yes, it is. Still plenty of time. I don't want anybody to hit the panic button yet.
And even if you are in panic, even if it's December 6th, even if it's December 7th.
We're there.
And you need to do it that day. We can make it happen that day, right?
That's exactly right.
And if you did it last week and you've given it some more thought and maybe some questions you forgot to ask or you wish you had asked, John, it's not too late to have that conversation.
No, you could have even already signed up for another plan for 2025, and it's still not too late to make a change if you would like to.
It's the last decision that you made.
That's what counts. That's right.
Yeah. So don't worry. Don't panic. Don't any of that. And yeah, there are a lot of questions, a lot of things to ask, and we're going to work our way through those. You can do all of this on the phone.
You can. Every bit of it can be done over the phone. So don't let a transportation issue hold you back. Give us a call. We'll make you comfortable over the phone and walk you through the process just like we would if we were face to face.
Do I really need this? And can I afford this?
Absolutely. The answer to both questions is yes.
Yes.
You absolutely need this. If you have original Medicare, you are stuck with a lot of out-of-pocket cost. That is on you. You have no cap on what you will spend. Your 20% will go on and on forever. So, yes, you do need this.
Let's just say the last 3 or 4, 10 years, you've been in perfect health.
Right.
You go walking every day, you go get your annual physical, but you've never had a worry, never a concern. And we hope it continues like that.
We do.
I mean, that's what we all want.
Mm-hmm.
But what if you stumble? What if the dog runs under your feet? What if you fall? What if you get a phone call from the doctor's office that says, can we see you again?
And that's the way it happens, Jeffrey. It always seems like whether it's an accident or illness, either one, they seem to happen overnight. And you wake up the next day and your whole health situation has changed.
Sure. And it's not anything that you've done wrong.
Right.
It is just part of that circle of life. And
it
can unexpectedly come up when you've never had an issue, never been a problem. My mom went from one weekend being just right, everything was as good as rain could possibly be, to being on dialysis. That happened in a span of about 24 hours.
And that is so typical.
So that happens to my family. It can happen to yours. That's not to worry you. Don't want to hang a dark cloud over you. But if that circumstance should present itself,
be prepared.
We want you to know, what are you looking at in a worst case scenario? What are you looking at out of pocket?
Mm-hmm.
And so that's what part of this process is. I've had my doctor for years and I love my doctor, and I don't want a plan where I can't see my doctor.
Right. Very important question. One of the first questions we ask you, whether meeting face-to-face or over the phone, is who is your list of doctors? We want to make sure they're in network.
Okay.
That's going to give you the best cost share for you, the least amount out of pocket for you if your doctors are in network.
Health Team Advantage is a local company.
We are. This is our 9th year in business. Home office is right in Greensboro. We are jointly owned by Cone Health and Novant Health, 2 local companies right here. So, yes, we are local. Our customer service is local, which is a key feature And a benefit of being a HTA member is if you have a question or concern, the person you're talking to on the other end of the phone is right here in the triad. We'll look for your doctor. We'll call your doctor, schedule an appointment for you. We make it as easy as we possibly can. We know if we do that for you, then you're more likely to keep that appointment. And staying on top of your health is the key to staying healthy.
But you're not restricted to just doctors in the Novant and Cone family.
No, that is correct. We also have Atrium Wake Forest Baptist in network. We have UNC Health in network. So, and then there's a lot of independent doctors that are in network that are not part of any of those systems.
Sure, across 33 counties in
That's
North Carolina.
exactly right.
So if you've got a question, and maybe you just moved, maybe you were in the mountains, you've moved closer to be to family, maybe you got tired of packing up all your stuff every time there was a hurricane threat, and you've spent the last 20 years at the beach, you said, I think I'm going to go inland for a while, have less stress. So although I admit walking on the beach is pretty peaceful.
Yes, it is.
But if you're now in one of these 33 counties, call and we'll get you hooked up. We'll tell you who's available, and then make that first appointment for you. You can go. And if it's not right, John, again, you got till December 7th. You can still
make that change.
Yeah, yes. Absolutely, you can. And then, as always, some people go, well, that's great, but I spend some of the year elsewhere. Or what if I'm traveling with my children and I have an emergency? That's just kind of goes without saying, doesn't it? But
you're covered just like you're at home.
Sure you are. So we want you to get out, go enjoy the world, see, live.
Yeah, even if it's outside of the states and you want to take a cruise or visit another country, you have out of the country care as well. Our healthcare concierge.
This is even better than the hotel concierge.
Yes, absolutely.
You call and say, this is where I am. This is what I'm confused about. This is what I need. And then they will. It's not like calling a stranger.
No.
Just calling somebody that knows your situation.
Exactly right. I think it is our number one asset that we have. The sad thing is most people don't know about the jewels they are until they are a member with us and get to experience it.
Yeah, and you will become friends on a first name basis.
Absolutely, yes.
I'm going to call John. I'm going to call Jeffrey because I know he'll know what to do.
That's my person.
So, yeah, and you will have a business card, a magnetic business card with their picture on it.
Right.
Be on the fridge. If you lose it, we'll send you another one.
Absolutely.
So don't you worry about that. We can get your phone number plugged into your phone. We can help you do that if you come to the Benefit Center.
That's right.
On Samet Drive. So you don't even have to worry about plugging in your phone number.
That's right.
With you every step of the way. And the hours for the local Benefit Center.
We are there 9 to 4, Monday through Friday. Our phone lines are open 7 days a week, 8 a.m. to 8 p.m. Now, I will say if you need to schedule an appointment outside of those hours, we will accommodate you.
So see, maybe and it can be something as simple as I want my daughter to be with me in this conversation.
Yes, and she works until 5.
Yeah, maybe she works until 8. She doesn't get off. She can't get to the phone until 9 o'clock or whatever it might be. But the answer is rarely no. We'll find a way.
We will find a way. I can guarantee you that.
So there you go. And I promised a quiz. Parts A, B, C, and D. So I'm going to let it go with that A and B, as you might suspect, original Medicare.
That is original Medicare. So you get Part A, and it's at no additional cost to you because you have paid for it your entire working life.
Okay.
So Part A is covered. Part B, you have to opt in for. You have to say, raise your hand to Social Security. I want Part B. Sign me up. And it's going to cost you for next year $185 a month.
Okay.
Now, if you qualify for Medicaid, you will not have to pay the $185 a month.
All right.
But outside of that, you will have a premium. That still leaves a lot of the cost burden on you because original Medicare only covers 80% of the medical cost. You have a deductible. If you go into the hospital, you're responsible for quite a big portion of the bill. And there is no stop loss, meaning your 20% keeps going on and on forever. Unfortunately, there is about 10% of the population that's all the coverage they have.
There really is a roll of the dice. You can make it through the year and not have to go to the doctor.
Right.
But probably the older we get,
you're one event away.
And the odds are not on your side.
No, they're not.
Eventually, there's going to come a day.
Yes. Unfortunately.
And there you are. And then you may not be able to just opt in that moment. You have to kind of see it coming, get out the crystal ball and go, I want to be ready for this year.
It's like right now is our enrollment time.
Sure.
So if you've gone years without being on a Medicare Advantage plan, you may be stuck waiting for October the 15th to roll around before you can enroll.
It's kind of like trying to get flood insurance when the hurricane hits tomorrow.
It's not happening.
That's not going to happen.
Right.
So now is the time to act.
Yes, absolutely.
All right. So we don't want you looking at this 20% in perpetuity.
No, we don't. So
there's a way to get around that, John.
Yeah, so you do have an option of Medicare supplement. That comes with a monthly premium as well.
Okay.
And those monthly premiums go up every year. I've had more people to call me this year, John, I've been on a Medicare supplement. My rates are getting higher than what I can afford. What's my other option? Medicare Advantage is the other option. And 9 times out of 10, the better of the options because it's a zero premium.
All right.
You have minimal cost shares, meaning you pay very small copays when you go to a doctor or have a procedure done. And it covers things like dental, vision, hearing, fitness benefits for like a gym membership.
Yeah.
So a lot of additional benefits that Medicare or Medicare supplement doesn't cover are built into a Medicare Advantage plan or a Part C plan. It will also include your drug coverage. The Part D is built into most Medicare Advantage plans. Whereas if you're on original Medicare, you have to buy a Part D plan. So that's more money out of pocket.
So you could be looking at literally 3 different policies to try to get something close to what you might get with your Medicare Advantage plan.
At a minimum, you're going to have to pay your Part B premium. You're going to have to pay a Medicare supplement premium. Then you're going to have to pay a Part D premium, and you still don't have dental or vision coverage.
Sure.
So you may have to buy a 4th
Those can
or
be
5th
extra,
policy.
right? And you're trying to keep up with all that and get pre-approvals and am I in network? Am I out of network? Save yourself the worry.
Keep it all in one neat little package.
One phone call, one website. And by the way, if you'd like to look at the website and start learning more, gathering information, it is HTANC.com. So we got Parts A and B, original Medicare.
Yep.
And then Part C is the fun stuff.
Part C is the fun stuff, the Medicare Advantage, the all-inclusive package that wraps everything up, one neat little bow on top, and you're done.
And we'll get that taken care of.
That's exactly right.
And don't you worry. The other big question, medicine, for so many of us, John, what am I looking at month in, month out?
Yes. Part D, prescription drugs, is always a big part of what we do every year. Once we know your doctors and hospitals that you want in network, the next question is, let's look at every drug you have. We need to tell you what your cost is going to be for that in 2025. The Inflation Reduction Act is fully in effect for 2025, meaning the dreaded donut hole or coverage gap is eliminated. So 5 years ago, you may have started the year out with some low copays for your drugs, and then you hit that donut hole coverage gap, and now all of a sudden you're paying hundreds for a drug that you may have been paying $10, $20, $30 for.
So the insurance company paid all that they're going to pay in that calendar year.
And you're responsible.
That's when you hit the donut hole. So the first 5 months, I was responsible for $20 a month.
Yep.
All of a sudden, the last half of the year, I'm responsible for $200 a month.
Yes.
And if you're on a set income, that can be a phenomenal mountain to try to navigate around and through.
Oh, and that's when you had so many people either cutting pills in half, or I just can't afford to fill that prescription, and I'm just going to have to go without.
Yeah, you do without,
which directly affects their health.
Sure, and rarely does that turn out well when we start trying to adjust our medicines by ourselves.
That's right. Now you're more time in the doctor's office, potentially hospital admissions, emergency room visits.
And it just starts to snowball at that point. The healthcare concierge
are
available. If your guy or gal are unavailable, you can either talk with one of the other HCCs or leave a message. They'll call you right back, John.
They have been extremely busy. We have gone from servicing 12 counties to 33. So there have been a lot more of the healthcare concierge hired, preparing for the new members coming in those new counties. So, yes, if they are busy, you can talk to the next available one, or you can leave a message and your personal healthcare concierge will call you back.
Yeah, and folks, these are folks that are familiar with your circumstance, your situation.
Right.
There are no two look-alike stories. Everybody's got different doctor, different concerns, different worries. You come from a different place, and we want you to feel comfortable and good and not nervous about the future.
That's right. I tell the people in that department every chance I get how appreciative we are of what they do. I couldn't do what they do, Jeffrey, but it is a calling. They to stay on the phone that long every day to take care of people's issues and problems, and do it with a smile on their face.
Yeah.
Yeah.
The patience of Job. You know, what may be an issue or a concern or a worry or confusing for you, another set of eyes may look at it and go, oh, I can get this resolved in a couple minutes.
That's right. Exactly.
We can do it right here together. You can be on the phone with us. So please don't worry. I know some folks in the age demographic for Medicare, they say, well, I don't want to bother them. I already called them once. Bother us. Please
keep
call
calling
as many times as you need
until you're satisfied with the answer you're getting. Occasional, you may get, I don't know the answer to that, but I will find it out and get right back with you.
I don't know. We appreciate the honesty. You'd rather have that 10 times out of 10. Some folks go, my health situation is not like everybody else. It's an extreme circumstance. It may be I'm a diabetic. Maybe I'm on dialysis. Maybe it's heart disease or chronic heart failure. But there are special programs that you all have already put into place for all of these folks too.
This is our 5th year in the market of having a chronic special needs plan for people who have diabetes or congestive heart failure. So yes, we go the extra mile. We take extra care of those members with those conditions to be sure they're living the healthiest life possible, managing that condition. We want to keep them as active as we can, not just physically, but socially.
Sure.
We don't want them to feel shut in and isolated. So there are a lot of programs that we put into place specifically for people who have those two conditions.
And it can be a lot to juggle when you're talking about dental and vision. Maybe you need to see a podiatrist. And for some diabetics, until they get that diagnosis, they've never considered going to a podiatrist. But that is an essential part of your long-term health care plan, isn't it?
It is, to the point that we have added that specialty of podiatrist as a zero copay to eliminate any cost barrier of going and having your feet checked. Very important for a diabetic.
And we want you to go.
Absolutely.
And if you feel something, if something doesn't look right, that's absolutely when you need to reach out. And if you're not sure, you don't want to call and be on hold at the doctor's office, understandable. Call your HCC.
That's right.
You have a special number. Y'all use the bat signal to get in touch with people, right?
That's right.
And so then you also, folks like cardiologists.
Yes, on that plan, they are zero copay as well. Your endocrinologist that is treating your diabetes, zero copay. Like I said, we're trying to eliminate any barrier from you getting the care and help you need to treat that condition.
And John, then some folks will go, okay, so this is the situation where I am. I'm dealing with it. I'm navigating it. I'm trying to take care of it. But sometimes, despite my best efforts, I end up in the hospital anyway. Okay.
Yes.
So that happens. Then frequently, John, there's a step between hospital and home.
Yes. So that's
you're not getting home. We just want to be sure that you are able to be home safely.
So we've got 3 safety nets there.
All right.
In case one fails, we got another one to go to. So you get skilled nursing care. You could be eligible for that after a hospital stay. If you have exhausted your skilled nursing care and every doctor that you're talking to that's treating you says it's time to go home, but in your mind, how can I go home? And that happens a lot.
Sure.
We have custodial care that can come in and help once you're at home.
Okay.
We have Papa Pals, which is additional care. Even if you don't need medical care, you can use the Papa Pals to come in, do light things around the house. If you just need social interaction,
sure,
they're there for that as well. You need someone to just run you to the grocery store, the drugstore. They're there to help with that. So we've got a lot of things in place to transition you from being in the hospital to being able to go home and fully take care of yourself again, A lot of steps in between, a lot of care in between to bridge that gap.
Yeah, I mean, it can be if you're an adult child and you're helping look after mom or dad or maybe a grandparent
Right.
at this point in your life, and you have to go out of town for the weekend.
You have to go out of you have to still work.
Right.
Maybe you're in that position. Okay, I can't be there until when I get off at 5.
Mm-hmm.
We've got that help that can be there during the day. You come in the evenings to help. We have eliminated that burden on the family member.
And that is such, when you can sit and rest and not have to worry, that just makes all the difference in the world, doesn't it?
And it only takes one simple call to your healthcare concierge
to put it all in motion. Some folks go, well, I don't know if I'm eligible. Well, John.
So you become eligible on the month you turn 65 for Medicare.
Okay. Did you say the month?
Yes.
December 30th.
You're born, you are eligible for Medicare December 1st. You can actually start the enrollment process with a Medicare Advantage plan, a Part C plan, 3 months before that.
All right.
To go into effect the first of that month you turn 65.
So it's not in effect in September.
That's right.
But you're going to go ahead and set it up, and you're not getting charged.
Then if you're late to the game and you feel like I missed my window to enroll, you've got 3 months after the month of your 65th birthday to sign up as well. Missed signing up by my 65th birthday. You got 6 months after.
Okay.
So don't feel like you've missed out. You have people who continue to work after 65.
Sure.
And they're on their group plan at work, which is perfectly fine as long as there are 20 or more employees on that plan.
All right.
If they're 20, if they're less than 20, you need to call us. That puts you in a whole different situation. But if they're more than 20, you're more than welcome to stay on that group plan. And then you can sign up for Medicare when you know you're about to retire. I tell people 3 months before you know you're going to retire, get in touch with Social Security, get everything in place. Then you have people, Jeffrey, who may be on disability. They are under 65, but something has happened and they're on disability. Those people are also eligible for Medicare. And then there are 2 specific health conditions that make you immediately eligible for Medicare.
There's no age requirement.
No age requirement.
No waiting period, nothing.
Nope. Okay. If you have been diagnosed with end-stage renal disease or Lou Gehrig's disease, either one of those, you're automatically qualified for Medicare.
All right. And so often we know of Lou Gehrig's disease as ALS. You would hear about that. And so if you're looking through medical papers, you get, and there's always a ton of them. And
end-stage renal disease.
Or if somebody mentions to you about being on dialysis. So that also might be a precursor to that disease. Normally they go hand in hand, not exclusively.
Not exclusively, but that's definitely a sign.
Yeah.
Yes.
So there you go. And again, don't worry. You got enough to deal with, getting to dialysis, taking care, because that is a changing your way of living. And who prepares about that? So let's go ahead and get your medical situation.
Let us take that burden off.
We'll take care of that for you, so you can focus on you. That's right. And then, of course, 65, you got to work your 40.
Yes, as long as you have worked your 40 quarters over your lifetime or 10 years, then your Part A is paid for. They've collected enough out of your check over the years to cover that. Or if you were a stay-at-home spouse, your 40 hours can be covered under the time that your spouse worked.
Yeah, a lot of folks will go, well, no, I was at home.
Right.
Taking care, doing a lot more work than the rest of us.
Absolutely. Yeah. I wish my job was 9 to 5.
Oh, yeah. Rearing children and taking care of the home front. So
right.
You are not left out on the outside looking in. Folks, your healthcare concierge is standing by. The number to call, 336-920-3648. The website, htanc.com. And the local benefit center on Summit Drive, 5815 Summit Drive in High Point, an easy drive from wherever you may be in the Piedmont Triad. Open 9 to 4 Monday through Friday, John.
That's right.
And your healthcare concierge, 8 to 8, 7 days a week.
That's exactly right.
And you've got through December 7th.
Yes.
To make your decision.
11:59 at night, December 7th.
Even if you did it yesterday and you changed your mind today, you talked with your family about it, and you want to go with a different plan,
that's your prerogative.
Don't you worry about it. Call as many times as you need to call.
That's right.
So here's one. I'm on Medicaid, and for those of you, Medicaid is a state plan.
That's right.
That's based on income.
It is.
If I have Medicaid, do I still get to participate in Medicare, which is a national program, and that is age-based?
Absolutely. A person can have both. We call those dual eligibles, where you have Medicare and Medicaid.
Here's another one. My husband or my wife has one plan. I think another plan through Health Team Advantage may be better for my situation because we're married. Do we have to have the same plan, or can he or she have theirs and I have mine?
No, you can have your own plan, because what works for one may not work for the other.
Okay.
So you're allowed to have completely separate plans. And even if you're on the same plan, you actually have two separate policies. Great question, though, because that's a little different than the group insurance that people are used to having before they turn 65.
Yeah, and you try to find something
that fits everybody in the family.
Go down the middle.
You can have your own.
Go. Pre-existing conditions, does that exclude me?
No, there are no excluded pre-existing conditions. So just because you have a diagnosis this year, that does not mean that diagnosis is not going to be covered if you change plans or companies. No pre-existing conditions.
When's the last time you heard that from an insurance provider or a Medicare supplement?
You will never hear it in the life insurance world. The ACA law kind of did away with pre-existing conditions for ACA plans. But yes, never part of Medicare.
We'll take you just as I am, as we used to say on Sunday.
You know, we will never ask you a health question because it has nothing to do whether you get coverage or not.
Okay.
The only time it may come up is if I notice that you're taking a diabetic drug, I may think, hey, you may be a candidate for our diabetic plan.
And there are more resources available. Can I be denied acceptance into Medicare when I turn 65?
The short answer is no. The only time that you may not be accepted into Medicare is dependent on citizenship status. 99.9% of the time, you're qualifying for Medicare once you turn 65.
So if there's a question that is unique to your circumstance, go ahead and ask, and we'll be sure we give you the exact right answer. John, we're out of time. Can you believe it?
It flew by.
You're going to be back with us soon.
I'll be back.
I'm looking forward to it, my friend.